parents the dearest gift bestowed upon their family is that of a life which at one point they thought was lost to them. To see her now, one would hardly imagine that at birth, baby Hope weighed just 400 grams and could fit in the palm of her mother's hand. In 2011, Winfrieda, a teacher who was then stationed in Wachira, learned that she was pregnant with twins, but complications soon set in.
She not only had a twin pregnancy, the second twin was dead, and she also had large uterine fibroids.
At 24 weeks, Winfrieda gave birth to a baby so small she decided to name her Hope.
When I looked at her, telling everyone here, I shed tears. I really asked myself why this happened to me.
The baby was put in an incubator which simulates the conditions in the womb. Her mother would arrive at the hospital daily to feed her and lay her on her bare chest in what is called kangaroo care. It paid off when, after 4 months, Hope hit the target weight of 2 kilograms and was permitted to go home.
To the child.
A year after her birth, she has returned, a lively toddler who has shaken off her past. American Amelia Taylor, the world's smallest premature baby, born alive in 2006, weighed just 283 grams at birth, but she survived. However, in developing countries, the odds are against such children, partly because they have inadequate resources. This, while the number of preterm babies born in the country is now rising. Today, Hope weighs 9 kilograms and has no lingering health problems, this reinforcing her parents' belief that her life was spared for a reason.
I know she will be a very great Kenyan, a great woman.
A hospital is a curious place for a non-patient to mark a birthday, but by returning here, Baby Hope is essentially giving hope to the parents of all these children that one day they too can walk out of this hospital healthy. Reporting for KTN in Nairobi, I'm Wilkis Nyabwa.
And that was a report filed by Wilkis Nyabwa 2 years ago. And joining us today, you've seen him on that clip, is Hope's dad. He's here with us, Lawrence Odong'o. You've seen him in that clip, and also with us for a discussion this morning on premature birth is Dr. John Wachira, who's a pediatrician. Thank you both for being with us.
Thank you.
Is it amazing watching that clip 2 years ago, seeing Baby Hope there, everybody's celebrating, they're cutting cake. She's just, you know, cluelessly, beautifully there, enjoying to be in the moment. As for you as parents, it's been quite a journey. Talk to us about it.
It is awesome.
Yeah.
And I'm grateful that now, 2 years down the line, Baby Hope is now a very big girl. She's enjoying herself. And we are hoping that all will be well.
Yes.
We are very happy and it is fantastic.
So talk to us, you know, conceiving, what your wife being pregnant, you're expectant, and this is, you know, expectant for a beautiful baby. But what happened?
It is a very long story.
Yeah. Summarize it for us.
The mother conceived, and after a few days of her pregnancy, she developed some problem, which we were not aware of what it was. By then, I was working in Wachira. So we had to airlift her to Kenyatta National Hospital. And when she was taken there, it was realized that she is having some growth in her womb, fibroids. And she was carrying twin babies. And the fibroids were big, and therefore there was not enough space for the twins to develop well. And therefore, she was put in bed rest for a few days, and she was advised not to do very hard work.
Right.
So she took some leave, and therefore she transferred from Wachira and temporarily decided to reside in Nairobi near the Kenyatta National Hospital. And therefore, after a short period of time, again the problem occurred, and therefore she was now advised to be taken for more checkup. And therefore, after some time, the problem was growing and growing, and therefore later on it was realized that one of the fetus was dead, and therefore she was induced so that the other one can also come out, so that her life is secured. But luckily enough, Baby Hope came out alive at 400 grams.
At 400 grams. How long was she? How, in terms of her pregnancy, how many months was it?
She was 22 weeks. That is roughly 5 months and 2 weeks.
And for you, it must have been bittersweet. Whilst you have hope with you, you'd lost one child.
No, she was very young, and therefore by that time we were not really optimistic that things will work.
Okay.
Because by that time her body organs were not fully developed. Actually, you could even see through what is inside her body. She was very tiny by that time.
Yeah.
So she was incubated and put in on oxygen. And when you went there, you will find her with so many machines around her. And by that time, even the doctor was not really sure if she will survive because of that tiny condition she was in.
Okay.
But things improved, and here we are.
And here
for 3 years and a few months.
3 years now.
Yes.
And we'll talk more about her status. Dr. Wachira, let's bring you in. Talk to us about premature births. That 1 in every children born in Kenya are born prematurely before their, the 37 weeks elapse. What causes this?
Okay, premature births are a big problem in Kenya, and they seem to be increasing, and they are contributing to the highest number of deaths, direct deaths below the age of 5 years. There are many risk factors to premature deaths. As Baba Hope mentioned, things like gynecological problems like fibroids would predispose to that. The second thing is multiple pregnancies. If one has twins again, it can predispose to that. If a mother has any illnesses, diabetes, high blood pressure, it can predispose to premature births. Having said that, there's a big number of babies who are born before their time, of whom there is no cause. There is actually no cause. Some people think it could be genetic, others think it is just unidentified causes. But the biggest number of premature births, there is actually no known cause.
Yeah. So what is usually the most important thing? Because when then it happens, especially when there's no cause to it, in as far as then handling the situation after the fact, what do you say is most important? Is it the period first during pregnancy in terms of those visits to the clinic, the prenatal care to check on the status of the baby, or is it after then this baby has come, then that is the most crucial stage?
The most crucial period is before the birth.
Okay.
If listening to Baba Hope, they were able to airlift the Hope's mother to a place where good care could be given. You can imagine what would have happened if the baby was born in Wachira. I mean, chance of survival would be 0. So good antenatal care, having checkups even before conceiving, and having good follow-up during the pregnancy would minimize the risk of premature birth, and also would improve the survival.
Yeah.
And then at the point of birth, there are low-cost interventions that can be done. Okay, Baby Hope was too small and therefore needed complex intervention, required high technology, which probably cannot only be provided by less than 10 hospitals in this country. But majority of the other babies can actually be saved by low-cost interventions.
Yeah. So talk to us what was going through your mind, Baba Hope. 400 grams, that's really small. Did you ever imagine that she could grow to be this lovely person she is today? Or at that time, were you just hopeful, as her name is, but still rather pessimistic?
Yeah, we were trying to be optimistic because of the kind of care she got by that time. She was in the private wing in Kenyatta National Hospital.
Right.
And by that time, you could see the nurses were upping their game. The doctor was always there. So that was giving us some hope that actually one time she will grow normally. Yeah.
You indicated there's one that was lost. How did Mom also just cope with all of this?
It was difficult. It was difficult for her to cope up with because of that happiness you are expecting, and then things happen not the way you expected. It was a bit discouraging. But now that Baby Hope was there, she was having some hope that I have lost one. There is one that is still here that I can hold.
Yeah.
Yes.
How long were you in hospital for? How long did Hope have to stay in hospital for?
She stayed there for 4 months.
And all this time in an incubator?
Yes, she was incubated for around 4 months, roughly 3 months and a few weeks.
Yeah.
That is when she was in the incubator.
And after leaving hospital, was there any special now care, or is it just as a normal baby that in terms of handling and caregiving, or was there special advice you were given?
Yeah, we were given some special advice by her doctor. She was called Dr. Karanja. And every time we were advised to go so that she can have checkup.
Okay.
Yes.
Dr. Wachira, Kenya been ranked 15 on this scale in terms of worldwide in comparison with other 188 countries. Why is it we're so high up in that scale?
I think as a country we have failed our preterm babies. Newborns are the weakest human beings, and preterm babies are most likely among the weakest human beings in existence. As a country, we haven't focused on that. I mean, it's only in the last 10 years that public hospitals have places for newborn units. And again, if you do a survey around the whole country, most of the public hospitals have no place for the preterm babies. They have no care plan for the preterm babies. So if you don't plan for them, then we have nothing to offer them.
So when they come, then they'll die?
Yeah, they'll die. And it's a pity that, it's a shame that in this time and age, about 96% of the preterm babies born in Kenya, in the rural areas, just die.
Wow.
Yeah. It's the only survivor that is there is in private hospitals and the big referral hospitals, where they are good specialists and good care. And World Health Organization shows by research that the cost of saving a preterm baby is very low. You talk about low-cost intervention. It's just breastfeeding that baby or providing the milk through a small tube that's less than 100 bob. It is keeping that baby warm through the mother's skin to skin at no cost at all. It is preventing infection by hand washing, and some minimal support if they get unwell with jaundice or some of the other conditions.
All right.
Yeah.
First, for the mothers and fathers, because they're very much involved in these processes, what is key advice that they must know once pregnant? In the event then there happens to be a preterm baby, what is most important for you in terms of telling them? What would you tell them?
One is anybody who gets premature labor, if you want to go into labor before the term, before the baby is the 40 weeks or the 9 months, as people would say, then they should go to a good center where they can deliver. They should go to a big hospital, so to call it, where good care can be given for the preterm baby. So that's of utmost importance. Then 2, they should get then the hospital should be able to give the essential care that's needed for that baby. So the key thing is to look for care where it can be given.
Where it can be given.
Yeah, not giving birth at home.
Not giving birth at home. So has Hope had any challenges, perhaps being sickly, any deformities now because of that? Has it had an impact on her health or her physical abilities?
Not yet. We have not yet realized any serious implications on her health, even though she has some problems in her breathing system.
Okay.
And I think this is alluded to the fact that during the time she was in the incubator, she was being fed through the nose for a very long period of time. So we think that might have been one of the causes of her breathing system.
Yeah.
But it is not to that magnitude that we can call it serious.
Serious.
We are trying to cope with that, though it is a bit expensive, because anytime we notice any slight problem in her, we have to rush her to the hospital so that we don't take any chances. So it is a very expensive to really take care of these preterm babies.
Yeah.
Yes.
How is she doing? Finally.
Right now, she's doing okay.
Yeah.
She's doing okay.
All right.
Yeah, she's doing okay.
Yeah.
And we thank God for that.
Okay. Daktari, for the stakeholders, more so for the government, and as far as more investment in this area and more information, especially at the grassroots levels, now that we have even devolution coming in, what must be done?
Okay, one is that newborns must be a priority by the county governments and by the national government and by all communities. And then 2, the government, whether at the national level or the devolved level, should have good data and good information of how many babies are being born in their area, so that they can be able to prepare and plan for their care. That's very important. The second thing is allocation of resources. There should be some careful thinking in terms of the way the resources are being invested. We have limited resources as a country, and therefore people should look at what the biggest need. 14,000 preterm babies are dying every year, and nothing is being allocated for them. When you look at I won't mention other conditions, but you get people spending millions of shillings in MRI scans and CT scans and things that may not necessarily save a life at that particular moment. And that money would have saved more lives if it was put in the preterm care. So allocation of resources. And then that thing is investment in capacity building. The health workers and the parents and the communities should be empowered to take care of newborns and the preterm babies. So that the people in the community should be able to highlight that as an emergency and speed up, take the mother to a good health facility. And then the small health facilities should be able to quickly transport or transfer any mother who is in preterm labor to a referral center.
Before we end, yesterday the day was marked for this premature birth. What did we see? What kind of activities, the theme, what focus was brought to this issue?
So yesterday we had celebrations here of the World Prematurity Day. In Nairobi, we marked that at Silver Springs Hotel. We had the Ministry of Health and other stakeholders on board, and the theme of the day was we are just focusing on the low-cost interventions that can save the preterm babies. Low-cost, high-impact interventions that can be done.
Okay, so we'll most likely see more work in that direction.
Yes, there's a lot of work going on. There are many stakeholders on board, and there's a lot of work that's going on. Our national referral hospitals are on the forefront, but now we need mobilization of the communities, the governments, and other stakeholders.
Okay, finally from you, Baba Hope, what do you tell parents who perhaps some are going through the same thing now, just got a preterm baby, or it may happen? You've mentioned very costly affair. What else would you say?
I would also say that before I even talk about the parents, the medical centers, like the doctor has just said, the government need to invest more in our clinics and hospitals, referral hospitals, because I remember when we took Baby Hope to the private wing, there was only one incubator, and she stayed there for 4 months, and I could see parents coming and they were not having access to an incubator because Baby Hope could not be removed for somebody else to do it, to get in there. In the public wing, you could see over 5 infants, children, in one incubator, which is a very serious health hazard. And therefore, I just want maybe to tell the government to increase. There is a room that will never be full, room to improve, because I've seen the free free maternity. They can also add more facilities in those particular, and also motivate the nurses and the doctors, because when they are motivated, they will work with all their heart. And then as parents, we as a family, we are trying to have some foundation that can encourage these parents, so that nobody could see as if they have lost hope when they are met with such circumstances. And I want to thank Her Excellency, the First Lady, about the Beyond Zero campaign. That is also another good initiative that can help encourage the mothers and also improve. And I would have wished if we can be involved as parents to help reach the people, because there are people who think that it is not possible for a child who is born that small, that age, to survive. And they need somebody to motivate them. That's why we are coming up with a foundation in the near future, next year, hopefully, so that we can bring on board such parents who are going through such scenarios.
Thank you both for joining us, and well said there, because coming from a place of experiencing it, then you really do understand the issues at hand. Lawrence Odong'o, who's also Baba Hope, our love to her and mommy, and also Dr. Wachira, who's a pediatrician, with us this morning, shedding more light on premature births. And as Lawrence Odong'o here said, a very important issue, bearing in mind that in Kenya, 1 of every 8 children is born before that period of pregnancy, the 37 weeks. So definitely the government must do more to ensure the deaths that come off of this, those numbers are reduced significantly. And most of the county governments, now that healthcare is devolved, so perhaps we'll see more activity in those areas as well. Thank you so much for watching today. So much of your feedback I wish I had time to read. Unfortunately not. Perhaps we'll be retweeting some of those later on in the day, but always a pleasure to be part of your morning. We'll see you tomorrow. I'm Sophia Wanuna.